dangerous, really. So I think we need to recognize that and be part of, a good influence. And we can do that for ourselves, really, by taking care of ourselves and talking to people who can support our feeling of discomfort and anxiety, and also other ways to make sure our psyches are strong, which is getting the right sleep and the right food and exercising. That all helps us to stay strong while we're witnessing history that's very upsetting.
Yeah, and Dr. Robi, I mean, we're witnessing history and really we're witnessing traumas, right? And experiencing them. But it doesn't just hit us on an emotional level. There's some physical consequences to that. You talked about the importance of eating and drinking, right? Some people lose their appetite. Some people can't sleep. Walk us through what that looks like.
So they are somatic responses. That's when the body feels the trauma. It can show up in terms of headaches. It can show up in terms of digestion issues, sleep-wake cycles, or hypervigilance, where we feel nervous and unsettled. And these are some of the physical symptoms that might indicate we're experiencing trauma.
I'm going to be honest, it has been hard to talk with my 21 and my 18-year-old kid. I can't imagine for people who have younger kids trying to explain what just happened. How do you best approach that with kids?
Well, I think the first thing is to regulate yourself, so kids will respond to your emotions, to ask them what they've heard, and then let them tell you what they know. You can then address some of the real issues that are going on. You want to, first of all, make them feel comfortable. You don't want to promise something that isn't true, but you could say horrible things happen, and look at the helpers that we're trying to help the situation, so that they feel a sense of comfort that we can do better moving forward, and also be part of the solution. Do you want to be part of a group that ensures safety? Do you want to write letters to people who were at the event? And so all of these things that help give back control, and for younger kids, make sure that there's play and you keep your schedule regular.
Yeah, and a lot of the tools you're outlining are really touching on what we need to cope. Can you dig into that a bit more? And also, if there's a sign that maybe we need further help, more professional help?
Yeah, I mean, I think if you feel like your whole world is out of control, it's hard to feel safe, it's hard to feel comfortable, maybe you don't want to leave the house, maybe you're feeling depressed, and it's interfering with your relationships or your ability to work and do things that you normally do for a period of 2 weeks or more, then you want to talk to a professional and see if there's anything else you should be doing for yourself.
And are there things that you were talking about what parents can do to make kids feel more comfortable? Are there things we should avoid?
Absolutely.
I'm wondering if we maybe should just put the phone down for a while.
Yeah, so we never want to tell our kids that they should just, be strong and not be upset. We want to encourage them to share their feelings with us. And if they have regressions, which we sometimes see with younger kids, like bedwetting, or maybe they have difficulties in terms of going in their diaper in a way that they didn't before. We want to make sure that we don't shame them for that or get angry with them for showing their emotions and feeling unsettled.
No, that's so good, because so many of us are feeling unsettled right now, and it's also okay to just sort of hold that for a minute and sit with it, both for yourself, your kids, whoever you care for.
So it's kind of, we have a right to feel unsettled, but what can we do about it that's pro-social is always the question we should ask ourselves.
Oh, well, thank you for helping us answer some of those questions, Dr. Robi Ludwig. We appreciate it.
I feel like I needed that too. Robi, thank you.